just hearing about it.
Yeah.
Mm-hmm.
I don't know about this weather. I don't know.
Mm-hmm.
Back to rain tomorrow.
Back to rain tomorrow?
Yeah.
It's
So
okay.
it's supposed to be some snow shower.
No, don't say snow. Really?
1 centimeter.
1 centimeter? Oh my goodness. One centimeter of snow. When's that supposed to happen?
I don't know. Sunday.
Sunday.
One of my sisters for the weekend, and I have to work too. But I want the weekend to be nice so I can work.
Yeah.
I don't like working in the rain.
No. Rain, snow.
Yeah. And of course it has to rain tomorrow.
Of course it does.
Go to her house in the pouring.
It's okay. We're just getting it out of the way now. So I'll come back and I'll work on these a little bit more, okay?
You do what you need to do.
We will do our best.
Feet are swollen. A bit. But it was payday today, so...
You were painting?
Paid.
Well, paid. It's payday.
You can't be that bad.
You can't, no, that's always a good day.
When'd you dye your hair?
Oh,
Yeah.
not too long ago, actually. It was
Looks
actually
really
last
good.
week. Thanks so much.
Yeah, it looks nice on you.
Aww.
When'd you dye your hair, Jack?
Oh yeah, I don't think I could afford that.
It does get
You
pricey.
get, I think I'm lucky that way. I only spend like $15 on my hair.
God, I paid $90-something.
It's crazy, eh?
You too?
Yep.
Yeah.
Yeah. Yeah, it was about 90 for the color and trim, which is decent these days.
Yeah, that is, isn't it?
Jeez.
What are you G's about my feet or?
No, geez, about
hair?
the hair. How often? I'm so naive when it comes to that stuff. How often would you have to get that done? Do you have to maintain that once you color? Like,
Yeah.
it's been colored, so you have to maintain that, right?
Mm-hmm.
Me, I have highlights, so 3 months. I get it done every 3 months.
3 months, eh?
My sister has a lot of gray, so she gets done every month or so. She gets it done.
Every month.
Yeah.
Oh my gosh. That would be crazy.
But I don't think she pays that as much.
Yeah.
I don't know. Our hairdresser's in Elmira, so.
Oh yeah. So we're gonna work on these corners a little bit, okay?
Mm-hmm.
You let me know if there's any pain or discomfort.
Mm-hmm.
Is it okay?
Yeah. It's supposed to be 17 degrees today.
17.
Yeah.
It was pretty nice earlier.
Kind of drizzling a bit.
17 would be awesome. I saw a sun coming out. It was pretty nice.
Yeah, there's the sun all day. It's hard to tell out in here.
It is hard. Yeah, especially with the reflection of the building over there. You can see how we want to continue the file and make this nice and clear. What ends up happening is you get an ingrown if you leave a wedge. So it's important, only we go in the corners. We don't really encourage them to do this on their own. Always cut straight across. Don't think just because I'm going in the corners that that's what's acceptable. We want people to cut straight across, but when it's indicated, you can cut and trim and file, but you have to clear the whole nail, and you have to go in with your blacks file to make sure that there's no residual kind of nail spikes. You want everything to be nice and smooth, so that's where an expert treatment such as this would come in. That is to maintain these nails because they are curved, and these curved nails will have a tendency to dig into the skin. So we just want to help them kind of grow straighter. So I'm just kind of wedging the nail a bit, and then I'm following, clearing out some debris as well. But you follow it back. You want to get all the little wedges.
Then your feet feel like $1 million, eh?
Yeah. When you're done. There's always doing an excellent job.
Well, thank you. We really appreciate that. Thank you. Is that okay?
Yeah.
Does that feel okay?
Yeah.
So that's nice and cleared.
My toe likes to go underneath it.
There we go. So we're gonna work on some of the callus now. So this little seed here you can see, that's a corn. Sorry if I bump into you.
Oh, that's okay. Same here. We'll have to get as close as possible.
So we'll work on this a little bit more in just a moment. We're gonna clear off the other callus. So when you're doing this, especially in these little awkward positions, you always got to watch where your hands are and where the edge of your blade is. So you can see how I'm cutting down, and my hands are nowhere near the angle or the path of that blade, and that's on purpose. So that way if we end up slipping or anything happens, or the patient twitches or gets tickled or something, the blade doesn't go into my hands.
Heels are always
They do tend to get bad, eh?
Mm-hmm.
Lots of discomfort until you come in to see us, right?
Yeah. Well, now we don't have to wear the boots. So
That's true.
your feet are kind of saying thank you. No more boots.
Yes.
Plus, you like to walk.
So then we're going to use the Morse disc on that.
Have your camera and my sister?
Have we?
Oh, I'm not sure if we have. We have videoed a lot of people, which is awesome.
That's awesome.
I love it when people say, yes, absolutely, you can video my feet.
Yeah. Why not?
Why not? Exactly. It's actually like, it's such an interesting kind of treatment. A lot of people want to see what's going on.
Mm-hmm.
Yeah, it's a good education.
Absolutely.
So you can see how thick some of this skin gets here. And the reason why this is thick here, you notice this bunion? So when you have a bunion, the toe doesn't bend as much, or it kind of takes a trajectory. The center of gravity takes a trajectory that's a little bit different. So you start putting a lot of pressure on the inside of this joint, and our skin responds to pressures. So whenever your skin feels like there's too much pressure, it'll start to lay down more skin a lot quickly. And the rate at which the skin grows is quicker, and it doesn't allow the skin to break apart as quickly. So it all kind of sticks together and gets all gummed up. So if that accumulates and you're still walking on it and you're still applying those pressures, it can become pretty sore. So it's important to manage the callus. Now, where this becomes an issue is with patients who have diabetes. If you have a pressure sore or an ulcer, technically, if there's any callus on the bottom of the foot, that's a good area where they might get a wound or an ulcer. So if you have diabetes and you have no sensation in your feet, it's really important that if you see any callus, that you get it managed correctly.
Absolutely.
Thank God, no diabetes.
That's good.
Glad to hear it.
So what we're going to do is use a Morse disc to finish off the debridement. So that way we got the bulk of this tissue removed. Now what we want to do is smooth it down so it doesn't get caught on anything and it feels comfortable.
Ta-da!
Ta-da.
That's it.
How's that feel?
Fantastic.
Awesome.
Feels good?
Yeah.
All right. Ready to
Excellent.
face the rest of the week?
Yeah.
Ready for another 10,000 clicks.
Yeah.
Very good, very good. So
Awesome.
now, put a little cream on it.
Maybe the best part, eh?
This part.
Feels good, eh?
Yeah.
Awesome.
So the heel is really important.
Moisturize it up.
Right on.
Ta-da! Thanks so much, you
You're
guys.
welcome.
Thank you.